Okay, so when we look at the kidney, we have the growth structure of the kidney. We look at the outer portion here is the cortex, and then the inner darker portion is the renal medulla as an area, and the structures in the renal medulla are these pyramid-looking structures. They're called the renal pyramids. And then from there, the apices of the renal pyramids feed into the renal calyces, and that feeds into the renal pelvis. From there, we go into the ureter, bladder, urethra, into the root. When we look at the vascularity that comes in, since we filter the blood in the kidneys, we have a lot of blood coming in here. The renal arteries here. Then as we get in between the pyramids, we call them interlobar arteries. At that point, then they reach across the pyramids. That's the arcuate arteries. And as those offshoots come off of the arcuates, then feeding the glomerulus, we call them interlobular arteries. From that point on, we go to this model over here. We have the afferent and the efferent arterioles that feed the renal corpuscles, Bowman's capsule. So the glomerulus is the arterial capillary system in here, and the Bowman's capsule is the outside layer that encloses it, that double-walled layer. So these podocytes are part of the Bowman's capsule. And the whole structure is called the renal corpuscle. As we then start from the renal corpuscle, we look at the beginning place of the nephron, which is our functional unit of the kidney. And it starts here at the glomerulus, the renal corpuscle, and comes after that, it goes into a convoluted tubule. That's a proximal convoluted tubule, closer to the corpuscle. You get into the medulla in a loop of Henle, a descending limb and an ascending limb, and then we get into another convoluted tubule, and that's the distal convoluted tubule before we reach into the collecting duct.